People with a diabetes diagnosis have to keep track of so many things like diet, blood sugar, but there's also a long-term risk, cardiovascular disease.
People with diabetes are 2 to 4 times more likely to die from cardiovascular disease. It's something HMG endocrinologist Dr. Ryan Kennedy says he watches very carefully with his patients.
Lots of people have heart disease, and die of heart disease is the #1 cause of death, but we see that happen much more frequently in patients with diabetes.
Dr. Kennedy says to stay healthy, those with diabetes need to learn their ABCs.
And when you talk about ABCs, A1C, blood pressure, cholesterol, and then the S on ABCs is stop smoking if you're smoking, because that also is a major red flag for cardiovascular disease.
Eating the right food goes a long way, and Dr. Kennedy shares a tip he tells his patients.
You want to eat food as close to the way God made it as possible, so if you can hunt it or pick it, you can probably eat it. You usually find that on the outside of the grocery store instead of the middle. If it's in a box or it has more than 5 ingredients, it's probably been processed. Okay. It's been processed, it gets broken down before it goes in your body. Broken down before it goes in your body, you absorb it more quickly, raises your blood sugar more quickly, requires a lot more insulin to control, and all that has bad correlations to diabetes, heart disease.
Other lifestyle choices like physical activity, adequate sleep, and managing stress can reduce risk factors. Kennedy says the doctor-patient relationship is crucial when dealing with medication and overall wellness of people with diabetes.
I think that's the challenge. I think a lot of people look at diabetes and think of it as just a numbers game, but you do have to have a lot of correlation and communication with the patient to understand how they're going to best control it and how they're doing as a patient beyond just what the numbers are.
Now, Dr. Kennedy says that he and his coworkers work with patients to make sure their medication is as effective and as affordable as possible. Josh?